how many of you are athletes, and how many of you have experienced or suffered from any type of knee injury such as ACL tears, which is the most common, especially in female athletes, meniscus tears, knee dislocation, or any other type of knee pains. Well, I'm Jatasha Hollinger, and today I'll be talking about the biomechanics associated with knee injuries during landing when jumping. Now, there are two reasons why I chose to do my presentation on this topic. The first reason is that I suffer from patellotendinitis, and the common name for this is known as jumper's knee, and I have it in both knees since my junior year of high school, and this is common in a lot of athletes, especially those who participate in activities or sports that requires a lot of jumping. And of course, I had to go through rehab and physical therapy, which consisted of heating and icing before and after practices and games, stretching before and after practices and games, and also knowing my limitations and knowing not to push myself too hard. The other reason is that I'm looking to pursue a career in physical therapy, more so on the sports medicine / rehabilitation side. And it is very important to know the biomechanics behind injuries such like this so that I can understand and also help prevent my patients from experiencing injuries like this, and also provide them with rehabilitation programs if they experience injuries like this so that they're able to get back into playing the sport that they love to do. Next, I'm getting into the knee anatomy. And the knee is the largest joint in the body and also the easiest to be injured. It is consisted of bones such as your femur, tibia, and patella, ACL, meniscus, ligaments known as collateral and cruciate, and also tendons. The biomechanical roles of the knee joints include are that it allows flexion, extension, rotation, and gait, provides stability, and also transmits, absorbs, and redistribute forces caused during daily life activities, such as walking, for example. So many sports like basketball, volleyball, and even track and field, more so the long jump and hurdlers, require some form of jumping and landing, which typically affects the lower extremities, especially the knees. And some factors that play a role in this is stresses which the body is subject to during performance. So not taking off and landing correctly can lead to excessive stress and strains on the knees, which can lead to knee injuries. Body position at landing, so good body posture is an important role for that one, and also performance execution and landing surfaces. And landing surfaces could be like, for example, in basketball, we play on wooden courts all the time. Next, I'm going into ground reaction force, also known as GRF, and this force is exerted by the ground on the body in contact with it, which is located posterior to the knee. Then you have your shear force, which is the force acting in a direction parallel to the surface, and that's located to the interior to the knee. And both of them have influences on the knee joints, which they correspond to one another, leading to a high risk of ACL tears. So too much of both of these can lead to a lot of lower extreme injuries such as ACL tears. Now, there was a study done on female recreational athletes, especially those who are going into recovery programs. And the study was using 3 verbal instructions which help reduce the likelihood of lower extremity injuries. And these verbal instructions include landing softly. This help increase knee flexion and reduce ground reaction force. Landing with knees over toes. This help increase knee flexion. And then you have landing with equal weight, which reduce ground reaction force as well. This all help benefit towards reducing the likelihood of knee injuries, especially in these female recreational athletes. So overall, the importance of landing when jumping impacts your lower extremities, especially knees, and ways to help prevent these injuries is correcting how you land. And these factors include making sure your knees don't come together while jumping, limit the amount that your knees turn in and touch when landing, also good posture when landing, and landing softly with knees over toes and equal weight, which I discussed in my last slide. All of these factors can help reduce the risk of knee injuries, and not just knee injuries, also the other lower extremities such as ankles and anything else in between. So just correcting those things can help prevent the risk of knee injuries and all those other lower extremities. And now we're getting to my works cited. And hope you guys enjoyed this presentation. I thank you for listening. If you have any questions, we'll get into that. Thank you.